Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Aaron Karn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along.
Kia ora, it's Erin Karn-Bennett here, and I'm so excited to be with you today on IPSS the podcast. I'm just dropping in here to talk to you about our guest who we are interviewing and you are listening to today, David Rodgers. I am so excited to interview him today about artificial intelligence and simulation, and I also just want to do a shameless plug to let you know that he is actually our keynote speaker for IPSSV, our Virtual Symposium, which is coming up in November 2024. It's on the 7th of November, 1 p.m. Pacific time or 4 p.m. Eastern time. I'm so excited for you to listen to this conversation. So welcome, David. It's great to have you with us on IPSS, the podcast today. Thanks for coming and being with us. So I did a little bit of pre-reading about you, David Rodgers, just to try and get my head around your bio and things and how to introduce you. I was quite overwhelmed with your level of experience and expertise that you bring to the table in healthcare and simulation, and I didn't really know where to start. And so I thought, well, do you maybe just want to tell us a little bit about yourself?
Sure. As you read in the various information you can find online and whatnot, I've been around a while and have done a lot of different things in healthcare and other things as well, from academics, research, and other areas. But within simulation, I got started in simulation just doing basic American Heart Association courses. A simple CPR class is a simulation program.
Yeah.
You're not doing it on real people. People sometimes forget that. But then as the technology evolved, as we learned more about it, we started introducing higher levels of technology, more comprehensive forms of debriefing, organizing the educational content, and it just kept growing and growing and growing. So it wasn't like there was a spark of a moment. It was a steadily evolving process until I got to where I am today. And I'm very fortunate. I've been very lucky to have met a lot of people, really smart people in simulation, but also in the broader education world. College courses I've taken and conferences I've been to, opportunities to work with others on a variety of programs. So I've been really fortunate to be influenced by a lot of different people over the years.
Yeah, definitely. And like you've got your finger in a lot of pies. You know, I was sort of reading about how you've been into paramedicine and how you're an editor on journals and all sorts of bits and pieces, which is really fascinating and sounds really cool.
Keeps me busy.
Yeah, definitely. What's been the best bits of your career in simulation so far?
So the big points have been, again, it's not just one big event or anything that came out. It's just, every day has the potential to be a new big point because something new evolves up. And just like we were doing now with artificial intelligence, having had the opportunity to work with the people I've worked with over the past 20 years in simulation, from all the different hospitals I was at, Children's Hospital of Philadelphia. I worked there for a while, great crew there. People at Penn State Hershey Medical Center, other places where I've worked with a lot of the folks at the Weiser Center in Pittsburgh. I did a lot of work with them as well. Working with corporate entities who make our products and helping to influence that has also been very influential. But I really get a kick out of the research and finding things new and presenting it to people, and which is what we did in December with our article in Simulation Healthcare and Artificial Intelligence, which was the first empirical data article to show up on AI and simulation. All the rest were commentaries, very good commentaries, but we were the first ones that actually put some data together on it, and we want to continue that.
Wow, that's pretty cool. And so can you tell us a little bit about how did you get involved with IPSS? At what point did you become involved with the society, and what's your kind of history been with IPSS?
At the risk of making some people kind of growl at me, I'm saying I didn't have a choice. I was at Children's Hospital Philadelphia when IPSS first got off the ground. And of course, Children's Hospital Philadelphia, CHOP, as it's colloquially known, has a lot of people that have been involved in IPSS for many, many years. And I had been involved in the Society for Simulation Healthcare and its previous organizations before it became SSH. But when IPSS came up, people at CHOP, people like Vinay Nankarni, Roberta Hales, folks like that were really at the forefront of it. Akira Nishizaki, just several other folks there and there's bunches of others. I couldn't get them all in on one list, but they were right there at the forefront of it, and things were happening. So it was a really opportune place to be. The first conference I went to for IPSSW was in New York City. I'd have to look the date up on that one, but that's been a while.
Yeah.
And I've been to most of them since then. Yeah. So it's been a good journey, good people to work with. And the most recent show in Denver was exceptional. We had the Inspire meeting there. Which really kicked off some things and with regards to artificial intelligence, and has turned into some other new opportunities for me. So it's been a great place for connections, a great place to learn, a great place to share.
Yeah, we certainly find the same here in New Zealand as well. And I mean, obviously part of this podcast is trying to promote IPSS and IPSSW, IPSSV, and get people to come along and join. So, it's great to kind of hear people like your history of how you got into it and what the journey's been like for you. So thank you. So as you've alluded to, we're kind of here to talk about AI today, which is definitely a very hot topic at the moment. And the inspiration from this episode kind of came from listening to your talk at IPSSW this year, which was about AI and simulation, the possibilities for the future, writing scenarios and assessments and things. Can you tell us a little bit about at what point did you become interested in AI? Like how did you get involved in this area?
Well, the whole history of AI and how it relates not only to simulation but to anything right now, actually a pretty short history. Artificial intelligence has been around for a long time, but it was relegated to people who knew how to program computers and had access to large systems and lots of money to do it and people to do all that. When the current version of AI came out, and I'm going to refer to ChatGPT, but there are others of them. When OpenAI, a company in the U.S. West Coast, came out with the ChatGPT, and it's only been about a year and a half. It's not been long.
Yeah.
That just changed things. It democratized access to artificial intelligence because you didn't need to be a programmer. All you need to do is type or talk, and you could interact with it. And you did it with a conversational tone. And the abilities of the AI changed as well, because before, when artificial intelligence was there as a program language, it was basically working off an algorithm. While that's still the case with a lot of the current AI products, there's more room for creativity and some spontaneous action by the AI itself that you don't get out of an algorithm. And so there are some surprises to it. Some of the surprises are good, some of the surprises are bad, but it does make it a little different. But having the current version of these large language models of these GPTs, generative pre-trained learners or tools, having those available really just, it opened it up to everybody. And when we started talking about it in our sim center in Bloomington, which is a small sim center, we have a lot of activity. We just finished, yesterday was the end of the academic year. So I tallied up my academic year numbers, and we had 8,500 learners, 27,000 contact hours, which isn't small. It's not huge, but it's not small. But we were looking at what we could do within our own center, and a couple of our staff looked at it and said, hey, this is pretty cool. And I started looking at it and said, you're right, this is pretty cool. And we started exploring options for using it. And that's what came into the SSH journal publication that was published on paper in December. And from there, it just has steadily kept rolling as we learn more things about it. We've been doing all sorts of little mini experiments saying, well, do this, we'll do that. How do I make it do this? And we're finding, yep, it'll do that. And it'll do it fairly easily without a lot of effort on our part. So it's really an interesting tool used appropriately, just like anything else.
Yeah. And so you kind of alluded to pros and cons. What are some of the pros and the cons? Because you kind of got into that a little bit at IPSSW, and I found that really fascinating, that stuff.
Yeah. So the pros are just the accessibility, the ease of use, the fact that you don't need any special skills to interact with it. I'll couch that just a little bit because there is a need for simulations to learn how to ask prompts, how to ask the questions for the AI to answer. There is a trick to that, or not a trick, but a skill to it. And that needs to be developed. And that's probably a new skill set that our simulationists are going to have to learn is how to interact with AI to get the best results. A skill set right now that most of them don't have, and they're probably going to get it by trial and error, but it'll be quick lessons learned. But that accessibility, ease of use, comprehensiveness of what it gives you is rather amazing. Just terrific potential. And it changes so fast right now. Just in the last couple of few weeks, we had the introduction of ChatGPT 4.0 Omni, which is the newest version, which took things a little further than even the regular 4.0 and definitely further than the 3.5. And I'm sure there's another version coming down the line that will be here before too long. And so as we see changes in this, because it is a competitive field on the vendor side, there's all sorts of people that are trying to push for this, from Adobe, from other sources within Microsoft, Google. If you've seen commercials lately, we're July 1st right now as we're talking. There's been a whole rash of Google commercials on the United States about Gemini.
Right.
I don't know if you're seeing those in New Zealand. So and that's their version of rebranding the Google Bard, pushing it forward to new levels. So there's rapid changes coming. So I view those as good because many of the changes are fixing some of the problems. The cons of it are you got to double check it. You just got to look at it because it doesn't tell you the truth all the time.
Yeah. Yeah, you were letting us know this about the lie stuff at IPSSW. It was great. Yeah.
It was amazing how good it is at lying. I can't really say it lies because it's a computer. So you have to have some human motivation to actually overtly lie. But it does take on some almost human-like quality that it wants to please you. So if it doesn't know the answer, it makes something up. And you've got to, trust but verify, reiterating that old saying. But looking at it and seeing what is true. The other is learning to watch for biases.
Right. Okay.
This is a big, big issue with it, particularly in the way that you interact with it. So if you start interacting with a bias already, it will recognize that and amplify it.
Right.
So you really need to be cautious of how you approach it, the language you're using, and again, looking at it and saying, from an step back a little bit and look at it and say, is this a balanced approach? So if I were creating scenarios, and this is just a hypothetical situation, and it's going to demonstrate a bias, which I don't have, but this is for demonstration purposes only. And I was doing something on domestic violence, and my first few iterations of it made it a low socioeconomic class household. It's going to just say, this must be common in all low socioeconomic.
Right.
And it starts repeating that, although domestic violence can occur in any household. And so you have to watch for that. And so you don't introduce biases to it, or you don't let it capitalize on biases it finds in its searches while it's being trained. So looking at all those things are going to be important. There's also some ethical issues about it. And there's all sorts of things out there already on copyright and ownership of product and all that. But if you have a simulation operations specialist who is producing fantastic scenarios, but you find out they're all produced with AI, how much of that is the sim op versus the AI? And so it's going to require a change in how we view using the tool. Now, I was at a presentation a while back, and it was on AI, but it was in broader scope of medicine. And somebody asked the presenter, they said, is AI going to replace me as a physician?
Right.
And the presenter said, no, you're going to be replaced by a physician who knows how to use AI.
Yeah,
and that's what we're going to see in simulation. Simulation isn't going to replace the sim ops specialist, the sim educator, but the sim ops person, the simulationist who knows how to use AI is going to have an advantage, and they're going to be pushing forward on that. And I think all simulationists need to recognize that.
Yeah, definitely. Like, we've had a play around with it here and there and, just use it more as like a framework of things. But, you can ask it to design you a curriculum on a simulation related subject, and it does. It comes out with some really great stuff.
Yeah. It's pretty remarkable.
It really is.
So fast. It just in a snap of time.
And I think it's stuff that we are all capable of creating, but it may have just taken us, like, say, 2 or 3 hours, but instead it's spat out in seconds.
I don't see the development of AI in this manner being much different than spell check. When I went to college, I was still on a typewriter in carbon. That's how I was a spell check. The biggest trick I learned to use is only use words you know how to spell.
Yeah.
And so when spell check came out in Word and all the other word processing documents, was that a true reflection of that individual's ability to write? Because they can now spell complex words.
Yeah.
Well, this is just taking that further, and they're learning how to use the latest iteration of that. So if you progress from spell check and Word to Grammarly or some of those other things that help you write better, more concisely and clear, this is just extending it further. So they're all tools. We just have to know how to use the tools responsibly.
Yeah, definitely. And so you were talking a bit about the development of writing scenarios and things with AI at conference. Can you talk a little bit more about that for us?
Yeah. The article we published has a great deal of detail, including samples of the scenario, not samples, the actual scenarios. We wrote 2 of them. They're available as the additional digital content in those articles. But we practiced a little just to see how it worked on scenarios that were not going to be our final product or weren't even a subject for it. And then we went in with what was at the time a pretty minimal amount of knowledge, and we had it build scenarios for us. We asked for an instructional goal. We asked for objectives. We asked for case flow. We asked for resources such as equipment, supplies, medications, and their dosing.
Right.
We asked for a debriefing guide. We did all this and then copied it all verbatim into a scenario template that we then had a group of other simulation experts evaluate using a simulation evaluation tool.
Right.
That had been published. And so we were really stunned at how accurate it was, except when we got to the references. The references were rather dismal. So,
okay.
The references, and again, I don't know why it does this. I've asked ChatGPT why it did that, and it just apologizes and said, I'm sorry, I won't do it again. But we asked for 10 references for each of the 2 articles. So we had 20 references, and 16 of them were fictitious.
Right.
Were completely made up, and they were fantastic fakes. They looked real. Everything about them, the people who wrote them, I knew several of the people that put down as authors.
Oh.
And they write on that subject, and this is where they publish at. And it took we had to go through all 20 and individually look them up to find out that only 4 of them were real, and one of those had errors in it. And then there were other things that were in it that just didn't make sense. We had one we were doing, it was an adult cardiac arrest, and it said, as the scenario was set up, it said that the patient was in VFib with flatline on the monitor. Well, that doesn't quite add up.
Yeah.
Our conclusion was ChatGPT watched too many medical dramas on
Yeah.
TV. So, because everybody shocks flatline. So that's what it must have been thinking. But it gave us some incongruent information. And so it needed to be edited for facts. It needed to be edited for that incongruency. One thing we thought we were being very specific with on the adult cardiac arrest was we asked it to follow American Heart Association guidelines. It did, but not the current ones. It was one series back. And so one of our drug doses was incorrect. It didn't reflect the current guidelines. And again, that's where it gets to prompt engineering, how to ask prompts. It's one thing to ask, I want the ACLS guidelines. It's another thing, I want the current American Heart Association ACLS guidelines.
Right.
That's going to give you potentially a different answer. You need to be that specific with it.
Yeah, so I see what you mean about learning how to use it effectively.
Another issue on it is the more specialized the topic, we anticipate the harder it is to use ChatGPT or any AI to give you good information. And we saw that because we used an adult scenario, we used a pediatric scenario. And when we had the scenario scored, the pediatric scenario actually scored less.
Right. Okay.
And that's congruent with the literature saying that when you start with a broader medical topic, it does pretty good. But when you start narrowing it down into a very specific area, it has a hard time pulling facts up. And so it just didn't do as good a job. Our biggest advice is start with something you already know just to see how it handles it.
Yeah.
And then from there, just remember to go in and check everything.
So with the referencing, do you have any idea why it lies like that? And do you think it'll get better with time?
It is improving. 4.0 Omni is a little better. We did a similar experiment with it a couple weeks ago, and the frequency of false references, made up references, was lower.
Okay.
But it still made some stuff up. There's great debate about why it does it. When you look at the literature, because this doesn't just happen in simulation, it happens everywhere.
Right.
It just doesn't like references.
Fascinating, eh?
So it has a hard time pulling that up.
Yeah.
And other professions have been really caught red-handed on it. There's a famous case that came out of the United States of a couple lawyers that got suspended because they used ChatGPT to help them write a brief.
Yes.
And they had cases in it that didn't exist. And the judge knew they didn't exist. He looked at it and said, this is just all garbage.
Right.
And they got in trouble for turning in a brief instead of doing their actual job.
Yeah.
And so it's not just simulation. It's having these things. They're called hallucinations or confabulations. Those are the terminologies you'll see. And there's really not been a good explanation for them yet.
So what are those? So what is hallucinations and confabulations?
So that's what the AI returns nonsensical information. That's the most common definition. It's just nonsense.
Right.
You read it and it looks good until you read it again and you realize that makes no sense at all.
Right. Yeah.
Such as VFib with a flat line on the monitor, or the incorrect references, things of that nature. And it's a frustrating part of using the AI. But as long as we know it's there and it needs to be checked, we should be in pretty good shape.
Yeah, it's so interesting, isn't it? And what about like the image and video generation and synthetic patients? Can you tell us a bit about that?
Oh, yeah, that's a really exciting area, particularly with the synthetic patients. So a synthetic patient, kind of like a virtual patient, but the terminology everybody's using is it's a synthetic patient. And with ChatGPT and other AI programs such as it, it's very easy to generate. Now, we have patients already that are virtual. So if you put on some of the patients, we use the goggles on and things like that and go into. But those required a substantial amount of programming and computer expertise in order to calculate all the different responses. The new AI, you just tell it its story.
Right.
And it doesn't need to be greatly in depth. And you just say, I want you to use this as a character that you're going to use in a role play.
Right.
And it says, great, I'll do that. And you just start talking to it, and it assumes that character's role. And it's voice interaction. So you can do it with voice. You can do it also typing, but voice works the best. So it makes it more natural integration with it. And you can just engage it in conversation. And this is particularly useful. And we talked about this at the Inspire meeting in Denver at IPSSW is and the reason it came up was, what are the ethics of having a child portray an individual who has an abuse and neglect background or has just been traumatized or hit by a car or something like that? And it's probably not fair to an 8-year-old, somebody's 8-year-old kid to say, we're going to pretend you got hit by a car. We're going to put a bunch of blood on you and you scream and yell. That could be pretty traumatic for an 8-year-old.
Yeah.
So taking patients like that and turning them into synthetic patients, giving them a short backstory. And the one we did was a child hit by a car. It was 6 sentences long. That was the whole story. And we were able to carry on a 5-minute conversation with the child. And the child was able to ask us questions. We were able to respond to it. It was very rich conversation. What's really nice about the AI is when you're done with that, it can do more. Because when we were done with it, I asked it, how empathetic was I as the nurse? And it came back and it said, here's how you did. And it gave me 5 or 6 different points on how I showed empathy with direct quotations that I said during it. So you could do all that. You could give it a scoring rubric and saying that you wanted to look at empathy, support, all these things. Give it a scoring rubric and it'll calculate a score for you.
Wow. Yeah.
So it does much more than just allow you the interaction. And what's so nice about it, because it is freely accessible, is this is ideal for a low-resource country or low-resource organization. Because instead of spending thousands of dollars on a complex, I'll just say like VR headset program, you can engage on your cell phone, a patient interaction, get feedback on it, and do it at any time. And you can ask it for suggestions on how to get better. And so it's very interactive. It's very good. You can train it to give you specific feedback based off a scoring rubric or a standard that you have. So it can use that. And so you can train it locally to be that patient, to give you the feedback designed on your system. And so that is an area that has tremendous capability.
Yeah, definitely.
And then we have the potential to do the same thing with debriefing, to record a debriefing and have ChatGPT listen to it.
Yeah.
And give you an idea and give you feedback on the debriefing.
Yeah.
And say you talk too much or something like that. It can tell you that. And or you said you didn't ask enough questions, or you concentrated on one learner. It'll pick up all that and give you feedback on it. And we've also experimented with actually having the AI evaluate scenarios in progress. And we've only done it so far with simple checklists. So yes, no, they did it or didn't do it.
Right.
And it scored those pretty accurately. And so, and then when we asked it for some detail, it would actually give us information that if I was a debriefer, I could look at and say, I need to bring that up in the debriefing.
Mm-hmm.
It'll actually give me more information I can take away and go into the debriefing and help use. So those are some use cases that are just incredible. And they're very simple to implement using the image and video generation. That's another area. Needs a little bit of work. It's not quite there yet.
Right.
But particularly, and this being IPSS, looking at pediatrics, it's not very ethical to say, I've got a lecture next week on asthma, and this kid really has bad asthma. Hold on, don't put him on oxygen yet. I want to get a picture of him. You can't do that.
Right.
But you can with AI. So you can ask for a presentation of a child that is having a severe asthma attack, either as a still image or as a short video loop.
Right.
And, if you go into your simulation room, all the kids look the same. I mean, they're not very expressive. Your mannequins, you may have different skin tones and some different facial shapes and whatnot, but you can't tell if they're distressed or happy or anything. So being able to put AI generated images up on the screen as they walk in the room, or a short video clip of what this child looks like, allows you to go ahead and embed AI generated content into the scenario that will enhance the reality of the scenario and give your learners an extra cue to work off of in order to tune into that mannequin that's on the bed and administer appropriate care.
It's kind of like that hybrid model, isn't it? The multiple realities. And I'm just sitting here listening to you, and I'm thinking low, middle income countries as well. And also, just across the world, everywhere, really. Like, we really have to train a whole bunch of health professionals. Like, we're so behind in the number of health professionals that we have and what we need. And especially in things like difficult conversations and communication, like, we know that communication is central to so many medical errors. And it's that great piece of the computer giving the feedback instead of the teacher, right? And, it's, we have Liddell RQI carts here for our CPR sign-off now. And people just love them, and the computer's the one telling them your CPR is not effective. And they like that.
And there's all sorts of folks out there who have finished a debriefing and they walk up to somebody else and how'd I do on that? And the normal response is, oh, you did fine.
Right. Yes.
And it's not what you want, but the computer will tell you. The AI will tell you with there's no emotion there to it. It's just telling you what it is. And so I think for anybody to continue to improve, it's a very simple, easy way to do. And it goes beyond just routine patient interactions. So you could create an error disclosure synthetic patient, and you could practice on it, and it'll give you feedback and say, well, you need to say you made a mistake because you had, and you just said everything but that. And so it'll help you find the words and give you the feedback on that. Even colleague interaction. Lennox Wong from Canada demonstrated a thing he did with using the AI to have a attending resident conversation about how the resident was having issues. How do you interact with that? So they created a backstory for the resident, and the attending physician sits down in interviews, and they get that. And so it's anything with communication, I think, can be picked up with this. And so it doesn't need to be patient provider. It can be provider to provider, family to provider, all across the board.
Yeah, wow. The possibilities are truly endless with it. And you've spoken a little bit about it, but what about assessment? I mean, we've talked about debriefing assessment, and you can kind of see that. Is there a scenario assessment or anything else that you can kind of see assessment-wise that AI could be used for?
Yeah, so on our early experiments on this, and we're very early in this, it successfully used a binary checklist to say they did or they didn't by looking at, actually what we did at that point was upload the transcript of the simulation, and everything was there. The one thing you're missing on the transcript is the actual actions. And that's our next step is, and it should do this. Everything I've read and people I've talked to said it should do it to upload a video and have it look at the video and analyze performance in the video. And so that's where we're going to next. So we can do something such as start an IV or put an IO in, see if it can follow the steps of the video. Particularly if we give it an exemplar, load an exemplar example and say, here's our exemplar example. Compare this to this video and tell us how they compare. So I anticipate some assessment capabilities coming in. As with most things in simulation, when we start talking about assessment in simulation, there's always, particularly summative assessment, there's always some worries about it.
Yeah.
Because it's still a simulation. But so I think for right now, I still feel more comfortable being assessed with a human involved in the process somewhere. Yeah. But to have some initial formative things done with AI, I think is very acceptable, particularly as it reduces faculty workload. You may have more chances to interact with it as a learner because, if you're doing something with your faculty, so you got one chance to practice and we're going to do it for real. Just because the faculty's not available, well, maybe now I got 5 or 6 chances to practice and use the AI feedback until I get to the human feedback and the summative assessment. So I think it's going to be a good augmentation to assessment. Maybe not yet to be a replacement, but a good augmentation to it.
So fascinating. And who do you look to or who else is doing work in this field? Because it seems like you're doing an awful lot, but who else is in there with you?
I think there's a lot of people doing stuff right now that we haven't heard from yet.
Yeah.
Because it's so new.
Yeah.
I've talked to a lot of people. I've been fortunate to talk about this first at IMSH in January, then IPSS in May. I've done a couple of other locations I've gone to, and people are just learning this right now. It's still very early. There are people doing stuff, but it's kind of localized. And the next step is to make sure we get out there and actually do some empirical research, do some, compare A versus B and do that. And I'm trying to work that up with some of our team here at Indiana University. We have a very active research team, particularly in pediatrics out of Riley Children's Hospital, and be able to engage them in this and see what we can do to really build up some things. I had a conversation last week with one group doing pediatric work, and they're very interested in this. They have a grant that is going to help them get interested in it. So I would anticipate some things coming out of that group. So I think there's a lot of people, the wheels are spinning right now. They've got their thinking hat on, and they're really looking through this process and seeing what can we do to generate, first, something that will benefit learners, and second, to generate responsible research that shows how it works and the best practices for using it.
Yeah, definitely. And is there any organizations or other resources that people can tap into for this if they're interested? So
there is one group that is starting to work on this, and I got to think of the name. It's coming out of the Center for Medical Simulation in Massachusetts General Hospital with that group. Janice Palaganis is a leader in that group. They have a website, and they've got a sign-up place. If you're interested, sign up. I will have to find the name for that.
That's okay. We can always put that in the show notes for later. Yeah.
I have a blank on that right now, but there are people now starting to organize for this, and so that's a big step.
Very cool. Well, thank you for coming and being interviewed today for IPSS, the podcast, David. It's been awesome. I've learned even more about AI, and you've piqued even more interest for me, so thank you so much.
Oh, my pleasure. It was enjoyed the conversation.
Thank you for listening to this episode of the IPSS podcast. A special thanks to our behind-the-scenes producer, the talented Danish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.